Well, the 2013 session is concluded. This was our long session. There were certainly some accomplishments, but also some disappointments. I guess starting with the accomplishments. First of all, very encouraged by the action taken by the General Assembly with respect to the Department of Child Services. First of all, very enthusiastic about the governor's choice to lead the department. That happened during the session. He chose a former judge up in Lake County, Judge Mary Beth Bonaventura. Legislators of both parties speak very highly of her, and we're very excited that she's going to be leading the Department of Child Services Agency. And the legislation that she has to work with, I think, will really make some great improvements for kids in the state of Indiana. We've created a local child fatality review teams, which I know all the local prosecutors very much wanted. We've provided some additional monies to hire quality caseworkers and retain the highest quality caseworkers. So I think we'll see significant improvements within the staff of the Department of Child Services. So very hopeful that also with the Legislative Oversight Committee that was created, that we'll see real and significant change finally within the Department of Child Services. The disappointments would have to start with the budget and definitely the lack of any sizable increase to K through 12 public education. For years we've seen cuts to public education. I was hoping we would at least restore past cuts to K through 12 public education, but the school corporations in my district will actually be receiving less money in 2015 once this budget cycle ends than frankly they received in 2011. Also very concerned about the significant expansion of vouchers and the fact that that's going to take additional monies from the public schools throughout South Bend and Mishawaka. So definitely some good things this session, but also some things I wish we would have done a little differently, and including, I should add, the failure to specifically require the governor to expand the Medicaid program to cover 400,000 Hoosiers and add 30,000 jobs in the healthcare field, all of which would have been paid for by the federal government 100%. As of now, that is in limbo. The legislature chose not to act on that issue, and that will be a significant step backward if we don't move forward at some point for public health in Indiana, and also, again, 30,000 jobs that could have been created and we could have started on this year.